If you're trying to figure out whether PRP or stem cell therapy is right for you, you're not alone. Here at Michigan Integrative Health, just about every day we get questions like, what's the real difference between PRP and stem cells? Which one actually works better? And people will ask, how do I know which treatment I need? Well, during the next 4 minutes, I'm going to break all of this down in a simple, easy way that will give you the necessary insight to make the right decision before you spend a dime. Hi, I'm Dr. Roy Picard, DC with Michigan Integrative Health. The medical team and I help people suffering with back, knee, hip, or shoulder pain who have already gone through the traditional insurance-based guidelines for chronic pain care like, the pills, physical therapy, chiropractic adjustments, cortisone injections, gel shots if it's your knee, and they still aren't getting the long-term results they deserve. So what we have done is designed an entire process to answer one thing. Can your body respond to regenerative care, and which option is actually appropriate for the level of damage you have? Let's start with the basic question, what's the difference between PRP and stem cell therapy? PRP, or platelet-rich plasma, comes from your own blood. We concentrate your platelets so that they release growth factors that tells your body to repair irritated tissue. PRP works great when the injury is mild to moderate, the tissue is inflamed, not necessarily destroyed, or you have tendon or ligament issues, as well as the arthritis might be at an early stage. Think of PRP as a strong signal for repair. Now, stem cell therapy, or as we offer it in the form of umbilical cord stem cells, or you sometimes hear the term human umbilical cord tissue products, these are rich substances that heal and repair. They include things like proteins, exosomes, growth factors, cytokines, and regenerative signaling cells. This option works best for moderate to severe arthritis, cartilage loss, bone-on-bone situations, long-term damage, basically when PRP simply isn't strong enough. Stem cell therapy delivers higher level regenerative signals and is often the better option when the joint is more deteriorated. If PRP is like sending a text message that says, hey, start healing, stem cell therapy is like sending a full construction crew with tools and instructions. I think you get the point. People always ask then, well, which one works better? Well, the truth is neither one is automatically better. It really depends entirely upon the severity of the tissue damage. PRP, again, works best when the tissue damage is mild, there's irritation but not destruction. Patients are usually younger, highly active, tendons or ligaments are involved. Okay, now stem cell therapy is more of, you've got cartilage loss, there's a lot of arthritis, moderate to severe. Previous treatment you tried didn't work. Perhaps you're trying to avoid surgery or joint replacement surgery. Basically, the body needs more regenerative support with stem cell therapy. The key is this: you should never choose a treatment until someone tests the joint and confirms what level of damage you're working with. And the last question is, well, how do I know which one I need? This is where most clinics, unfortunately, create confusion. We make it simple with a 3-step process. Step 1, complimentary phone consultation. You and I, we get on the phone, we talk. We first figure out your history, what you've tried, and whether coming in makes any sense at all. Step number 2 would be the in-office testing, x-rays. This is basically where you get immediate answers. We perform joint stability testing, guided movement and muscle testing. We're checking for motion, strength, and pain response to testing. X-rays to confirm severity of the damage, and in about 90% of the cases, the patients experience either improved motion, improved strength, or reduced pain during the testing itself. That tells us whether the joint is capable of responding to regenerative care before you commit to anything. And step number 3 is you choose the plan if testing shows you're a candidate, because we're going to write out 2 to 3 options depending upon the level of damage, whether PRP or stem cells are appropriate. Depends on your goals, your budget, and even how far away from the office you live. You stay completely in control. No pressure, no guessing, just clarity. Here's a quick example. Mary struggled with severe back pain for over 12 years. She was taking between 15 to 20 pain pills per day. She tried therapy, chiropractic, medications, injections. Nothing worked. She went through our process, received care, got off her medications, was then able to live a normal life, all as a result of a 90% recovery. Before you decide whether PRP or stem cell therapy is right for you, I strongly recommend you get tested first so that you actually understand what your body needs. Give us a call, 586-726-9860. Receive a complimentary phone consultation with us. We'll help you get the answers you've been trying to find for months or possibly even years, so that you can finally move forward, get the results you deserve, and get your life back.